When I talk to groups and I talk to individuals, I talk about bridging patients. The fact is, in a grid down situation or survival situation, medical help is not coming. 911 is typically 12 minutes away. In this scenario, there's no 911. The hospitals are already overwhelmed as it is on a normal basis, and we have a disaster occur or something catastrophic occur, there's going to be no hospitals available. So I talk about bridging patients that we can hunker down with, that we can treat until we can get help to come back, whether that be hours, days, or weeks. If I have someone who's having a heart attack and it's a grid down situation, ultimately that person still needs a heart catheterization. Now, could I try cayenne pepper? Could I try some other things? Absolutely. But ultimately that patient still needs to be in a heart cath. So we can bridge this patient. We can help take care of this patient until we can get this patient to a hospital. Same thing, we have someone who's got a major trauma, major injury. They still need a trauma surgeon probably. But we can bridge that patient, take care of that patient, prevent them from getting infection until things return back to normal. And we're talking about bridging trauma patients. The two things that I'm worried about is, one is of course stop the bleeding, and then preventing infection. You know, that's probably going to be a huge issue if we do have a grid down situation or survival situation, is with these open wounds, these open traumatic injuries that are going to get infected. Your patient is going to start running a fever and they're going to die of sepsis because of infection. You know, we talk about a grid down situation. This could be anything from a natural disaster, a hurricane, tornado come through, the zombies are coming. It could be any of those scenarios, but ultimately it's going to overwhelm EMS, it's going to overwhelm the hospitals, which is why I do my channel. This is why I offer these videos to you guys, is to provide you some medical knowledge to help with patient care in a grid down or survival or natural disaster situation. Let me know what you guys think about bridging patients. You know, are you equipped enough to handle really sick medical patients or really sick trauma patients in your medical scenario for your grid down situation? I hope this video helps. You never know when you'll be the first responder.